Today on the Perception and Action podcast, how do different S&C training methods relate to injury prevention? For example, which is better for learning to do a squat? An external focus of attention instruction, self-controlled feedback, or differential learning? So it's time for a call to action. Hi, this is Rob Gray from Arizona State University. I've been on a now over 25-year journey as a researcher, professor, and high-performance consultant to understand how we acquire and adapt our perceptual motor skills. Welcome to the Perception and Action podcast, where I discuss how psychological research can be applied to improving performance, accelerating skill acquisition, and designing technologies. Before we get to today's topic, I want to tell you about a couple extra things that might interest you if you're enjoying the podcast. First, my book, How We Learn to Move, A Revolution in the Way We Coach and Practice Sports Skills, is now available in audiobook format. You can find it on Audible or Amazon. Second, if you're interested in working directly with me, I currently have openings in my monthly mentorship program. This includes monthly Zoom meetings, either one-on-one or with your staff, analysis of your practice designs, and a monthly group discussion with coaches and instructors from a range of different sports. To find out more, please go to patreon.com/perceptionaction. Now on to the show. Hi, everyone. This is Rob Gray from the ASU and the Perception Action podcast, back with another article review. Today, I want to focus on a new article that I just recently added to my list on my website of comparative training studies. So for those that don't know, I keep a running list on my website, perceptionaction.com/comparative, of studies that have made direct comparisons between different training methods, in particular, those that make direct comparisons between traditional prescriptive methods, which you're focused on getting the person to perform a correct ideal technique, versus ones that promote self-organization, like differential learning and constraints-led approach. And this new study that just put in is by Ganti and colleagues with Wolfgang Schorhorn, looking at differential learning and a couple other types of training. This study, like the one, actually pointing at the wrong one here, but different, the one by Elegy and colleagues from 2021, is particularly focused on how these methods influence injury and the risk factors for ACL injury. So the study, as I mentioned, was published by this group led by Wolfgang Schorhorn. The interesting thing about this study is it's not focused specifically on training a sports skill like the previous other ones on my table that were focused on soccer, baseball batting, shot put, etc. This is actually focused on looking at S&C training, right? So doing a bunch of exercises like squats and lunges and in different ways and looking at how that changes risk factors for ACL injuries. So diving into this, the authors mention, they go through the risk factors. They mention, the particularly landing phases of movements are particularly where a lot of injuries occur. And this is we can identify particular kinematic and kinetic aspects of the movement that increase the risk. For example, obviously landing with a lot of ground reaction force in the vertical direction, right, is going to increase injury. And also in the knee abduction and hip abduction, the angles, we want those smaller, right, when you're landing because they place you at less risk for injury, right? So we can identify these markers for ACL injury that have been shown in several other studies, and the Orangi et al. Study I mentioned used a similar ones as this as well, right? So you can go back. I've talked about that in a previous episode. So, what training methods did they look at? Well, in their introduction, they go and make the classical skill acquisition theory distinction that I've made, the two theories, right? They talk about cognitive approaches, right? Where we're prescribing some ideal solution versus self-organization approaches. And of course, they're focusing on differential learning. So the two prescriptive cognitive approaches they're going to focus on in the study is self-controlled feedback, right? So I've talked about it previously on podcasts. There's a lot of research actually being challenged a little bit now, but there's a lot of previous research showing that learning is best when observers control when they get the feedback, right? And so instead of giving them feedback on every trial, you bent your knees too much, you allow them to ask for it on certain trials. Okay. As I said, there's a lot of benefits for that. So in their study, what they're going to do is actually show people, here's a video of how to do a squat, right? You do a squat and then you ask for feedback. When you ask for feedback, it's going to be corrective, right? You went down too deep, right? So it is prescriptive. The other condition they're going to have for prescription is external focus of attention instructions, right? So we're going to give you instructions on how to perform a squat, focusing on, an external focus. Move towards that cone, right? Push away from the ground, right? That idea, right? So both of them, though, they're designed to get you to perform a particular technique. Whereas differential learning, as we've talked about several times on the podcast, right, is getting you to explore the movement space, the solution space, by trying lots of different movements, not trying to get you to do a particular one way to do a squat, for example. So those are the three training methods, right? In the paper, they kind of emphasize some of the key points, and they talk about, there's various types of differential learning. In the most extreme form, again, what we want you to do is get you to perform as many different possibilities as possible. Okay. So they point this out later. We're not talking about repetition without repetition, right? We're not talking about you getting the same goal in different ways. We're talking about just no repetition at all, right? Getting you to perform totally different movements. The important thing to emphasize, there's no feedback given in differential learning because we want true self-organization. We're not guiding you towards a particular area of the solution space, okay? They also talk about the fact that really the benefits of feedback in research are shown where a person is trying to repeat a particular movement, right? When you're repeating a movement, you're not going to get to experience the solution space, the differences between doing that with a wide stance and a narrow stance, because all your movements are going to be fairly close together when you're trying to repeat. So they argue, don't need feedback when you're doing differential learning because you're getting a lot, as the last point here makes, you're getting a lot of your own intrinsic sensory feedback, right? You're getting to experience the differences between these types of movement. You don't need to be given external feedback telling you what happened. Okay, so that's some of the basic points about differential learning. So in the present study, they're going to compare the effects of differential learning, self-controlled feedback, and external focus of attention instructions on the kinetic and kinematic markers for ACL injury risk factors, right? So in one way, I really like this study. This study is going to lack a little bit in terms of control of being able to identify what are the precise factors and mechanisms that are producing the results, because obviously differential learning has external instructions within it. Self-controlled feedback can be external, right? So trying to tease apart what exactly caused the effects is difficult because of the design. What they chose to sacrifice that for is using methods that are actually fairly common in actual practice application, right? So having you watch a movement and then get asked for feedback is something we do all the time. Giving you lots of instructions about performing a movement, something we do all the time, and then differential learning. So what they're going to hypothesize is that based on the large literature of benefits of external focus, that's going to help. Differential learning is going to help in terms of reducing these risk factors. And the particular ones I want to pull out of the data are the vertical ground reaction forces and the knee abduction angle. We want both of these to go down, right? Both of these to get smaller after training to reduce the risk factors. Okay. So that's the kind of what they're going to do. What they did was take 42 athletes from a variety of different sports. They randomly assigned them to one of the three training groups or a control group that just did their regular sports practice, right? Before and after training, they did a single leg landing test, right? So they jumped off a box of a height of 0.3 meters, landed on one leg, right? And they measured the forces and the angles and the moments of force, right? Again, in this study, this is not a sports skill training study. It's an S&C study, right? So what they're going to do in the training between the pre and post jump landing tests are 8 weeks of S&C training where they're going to do different classical weight room exercises, right, for 8 weeks, but of course in different ways, right? And then the control group, as I said, is just going to practice their sport skills. Okay. So the three groups, training groups, are going to do double leg squats, lunges, single leg squats, jumping movements, all these kind of different kind of movements. In the differential learning group, they're going to be a central exercise, like a double leg squat, but of course there's going to be massive variations where you're almost losing what the exercise is, but there are guided around these central 8 types of exercises. So let's go into more detail about the actual training. Okay. So external focus of attention training. So athletes there's some kind of perturbations of stability, for example, on the trampoline. Athletes are given landmarks to help guide their movements, cones, objects in the environment. While they're doing these exercises, they're given verbal feedback instructions, and both before and after the movements, with an external focus to try to get them to perform a particular form. Okay, so let's look at some examples, right? So a double leg squat, the external focus of attention instruction might be, while bending your knees, point your knees towards the cones and imagine you're going to sit on a chair while keeping a ball between your knees. Okay. A lunge might be, while imagining you have a plank on your back, point your knees towards the imaginary point in front of you. Right. So we're trying to get a particular movement form. Again, this is a critique I had in one of this group's previous studies, right? I think a lot of people would challenge the idea that these are really truly external focus of attention instructions because they have a lot of reference to your body, okay? They also are using analogies, right, within it as well, having a plank on your back, sitting in a chair, right? So they really have a mixed bag of I would call them mixed instructions, internal, external, and analogy, right? Rather than external focus. I think that's a bit of a misnomer for this condition. But anyways, that's really not the point of this study. The point of this study is not to compare internal versus external, right? They're trying to, if I'm going to use prescriptive instructions, what are the ones that are shown to be the best? Let's focus on external references and things. So that's really what they were trying to do. Again, sacrificing a bit of more realistic application for experimental control, I would say, was what they were trying to do in this paper, which I totally understand and sympathize with. Differential learning. So differential learning, they're going to do a program of exercises where there's no repetition at all. So it's not trying to do things in just slightly different angles or positions like repetition without repetition. It's doing lots of different things where you never repeat the same thing. And so there's no repetition. Every single execution, you're doing something different about the movement, not just moving in a different way to achieve the same goal. You're doing a completely different movement. There's no correction given by the coach at all. So, for example, a double leg jumping task, they're still doing with 2 legs, but they're doing it in sand, with and without shoes, with and without the lights on, and so on. On each trial, something's different. Okay. They're self-organizing, right? They're moving, but they're not doing it in any without any explicit information about how. So there's no even the slightest guidance towards a solution, right? They're told to jump on both legs just in the dark, right? Not how to do it. Okay. The instructors were given creativity about how to organize these, but they kept track of the order, right? And let's look at some examples. So double leg jumping, before jumping, do 3 or 4 bunny hops in different directions. Make a jump with a full turn to the left and to the right. While landing, put one arm behind you and the other in front of you. Land with a narrow, very wide stance, in sand, without shoes, so on. So every single trial, we're doing something different. Doing this double leg jump in a different way. Again, we're not trying to lead you to a specific solution on how to properly jump on 2 legs, right? We're trying to get you to explore and be able to contrast different movement solutions, right? Obviously, as I pointed out, this has some external and internal instructions within it, right? So, again, it's not teasing apart these things. So this is the basic idea. So the first 2 are learning to do squats in some kind of prescriptive way, in different ways, while the differential learning jump are doing a squat type movement under a lot of different variants. Okay. not aiming towards a particular form. Okay, so that's what's going on here. The self-control feedback group, as I mentioned, they did all the exercises. They were given observational learning. The coach showed them how to do it, and they were asked to copy and repeat it. If they asked for feedback, the instructions were basically external, the type of instructions the other group explained, sort of corrective, getting you to move towards the correct form. But they were given the option of when to ask for them. Again, something that's been shown to be beneficial in previous research. Okay, what did they find? What did they find for these 3 training groups? The basic finding was that for the differential learning and external focus of attention groups, there was significant reductions in the key markers for ACL injury. And this is shown here. If we look at, right, for example, the knee abduction angle, in the control group, there was no significant change. It went from 13.5 to 13.7. In the self-control group, there was a slight decrease, but it wasn't significant, from 13.5 to about 12.5. In the external tension groups, there was a significant reduction, 13.5 to 10, while in the differential learning group, there was about 13.2 to 6.8, so almost cutting more than in half. And that's another basic finding. So the overall finding of the study is that both the differential learning and the external, what I would call mixed focus of attention instructions worked, with the greater effects happening in the differential learning. They had greater reductions in the markers. Okay, similar results were seen for the ground reaction forces, right? So control group 32 to 32, no change. Vertical reaction force, the peak. Self-control feedback 30 to 31, 31 to 30, no significant change. External focus 31 to 30. In this case, that was not a significant change. Okay. Whereas the differential learning went from 32 to 26, right? So seeing a significant change, right? So again, well, I think the external focus was just significant, right? So we are seeing some benefits of this going on, right? So the bottom line, what the authors conclude is the study hypothesis with concurrent differential learning and internal focus of attention approaches allow for reduction in these markers for knee injury in the joint landing task, in the single leg landing task, with the differential learning seem to get at the maximal results. This is similar to what was found in the Orangi et al. Study I talked about at the start, right? They did soccer training with prescriptive differential learning and constraints-led approach, for example, small-sided games. What they found was differential learning and constraints both reduced the markers, with the constraints having the higher effect than differential learning. Okay, so some of the slight differences. Again, they will argue that what's going on here is differential learning allows an individual to become more flexible and adaptable in a shorter period of time. They can produce smoother movements with less ground reaction forces because they have the variability in training is getting them to come up with a wider range of movement solutions, right? So essentially, although there wasn't repetition in the training, that's what it's giving them when actually performing a task, like in sports like landing after a basketball shot. Okay, so more variability in training is functional. It increases your movement coordination repertoire, enhancing your adaptiveness and reducing the risk of injury. So overall, I think this is a really excellent study that adds to nicely to that list of comparison studies. Save the kind of issues with the methodology, which I don't think are so important here because it's not really the goal of the study to tease apart internal versus external again. Right? I think that's those issues I raised are not as critical. But most importantly, I think this is another page that I have on my website. It's perceptionaction.com/injury. It adds to this really exciting, increasing body of knowledge of what I've been calling an ecological approach to injury, sports injury prevention, right? So the idea that what we want to do is reduce injury by creating adaptable, variable, as Bernstein would call it, dexterous athletes, people that can solve the same movement problem in different ways. Not only that make you more skillful and perform better, it reduces the chance of injury by giving you, distributing the forces better, giving you better, less ground reaction forces, more angles, and so on, right? So if you're interested in this topic, have a look at that I've added this article to that page as well. Okay, that's it for today's episode. Thanks for joining me as always. Keep them coupled, and cheers for now. Okay, that's it for today's episode. Remember, you can contact me at robgray@asu.edu or follow me on Twitter at ShakyWeights. To find out more about the podcast, please check out perceptionaction.com. Finally, to support the podcast and receive bonus materials, including written transcripts, please head over to patreon.com/perceptionaction. This is Rob Gray from ASU. Cheers for now, and keep them coupled.
Gone straight away.